What is cancer? Simple. Cancer is when a group of cells multiply at fast rates. These cells rob the body of nutrients, disable organs, and all while being undetected by the immune system. These cells continue to spread at alarming speeds. Complex. When malignant cells fail to go through apoptosis and contact inhibition, these cells go through the cell cycle at rapid rates, so they are constantly multiplying. This is due to the interphase being shortened and suppressor genes and cyclins failing to stop mitosis. If this continues long enough, metastasis may occur, causing other organs to become infected.
Wilms tumor is a type of kidney cancer. The cancer can stop the kidneys from doing their job of filtering the blood, removing water, salt, and waste products. They also regulate the body's white blood cell count and blood pressure. So if Wilms tumor destroys the kidneys, the blood waste will build up in the bloodstream and cells will not get needed nutrients, so they will die.
Symptoms are an abdominal swelling, an abdominal mass you can feel, abdominal pain, fever, and blood and urine. Screenings and tests are testing your blood pressure, blood and urine tests, CA and CAT scans, ultrasounds, x-rays, and surgery. Wilms tumor treatment varies upon the stage of the cancer. Stages 1 and 2, surgery. Stage 3, chemotherapy and surgery. Stages 4 and 5, intense radiation and chemotherapy, followed by surgery.
Partial nephrectomy. The tumor in some kidney tissue is removed. Radical nephrectomy. A kidney and nearby tissues are removed. Radical nephrectomy. If both kidneys are affected, then some tissue in both kidneys are removed. Sometimes both kidneys are removed and the patient receives a transplant. Side effects: internal bleeding, infections, pain, and problems with digestion. 81 to 83% success rate with a bad histology, 90 to 99 with a good one.
Chemotherapy. A combination of drugs administered through a pill or directly into a vein that combine together to specifically kill cancer cells. The drugs target cells that divide rapidly, and so, hair, bone marrow, and liver cells are usually killed in addition. It may be used to shrink a tumor, making it more easily removable, or just to remove the cancer entirely. Chemotherapy will decrease the chance of a kidney needing to be removed. Side effects include loss of hair and appetite, vomiting, nausea, and frequent infections due to a compromised immune system.
Radiation therapy. High-energy X-rays aimed at cancer cells that have survived chemotherapy and surgery. This is especially used if the cancer has spread to other organs or is about to metastasis. Side effects: sunburn, fatigue, diarrhea, or nausea.
Clinical trials take place in a research study on the latest possible cancer treatments. However, they are not proven and may not work. Side effects depend on what one is enrolled in.
Demographics: age 3 to 4, gender, girl, race, African American. People with a birth defect, hemorrhagic have a greater chance of developing this cancer. Wilms tumor is a part of these syndromes: UAGR syndrome, Den-Strass syndrome, and Beckwith-Wiedemann syndrome.
Research. The majority of research on Wilms tumor in the United States is done by the Children's Oncology Group, or COG, and the Mayo Clinic. There are numerous COG research facilities in Pennsylvania. The closest ones are in Penn State, Danville, and Philadelphia. One of the new ways of curing Wilms tumor is through stem cell transplants, because they increase the amount of chemotherapy the body can take. Also, the stem cells can differentiate into white blood cells that can eliminate pathogens. This is a critical treatment if the cancer cells in someone's body do not respond to surgery, chemotherapy, or radiation therapy. Stem cells from the patient's own body can be taken, then re-injected to go to the bone marrow and repair the immune system, and then create more red blood cells and T cells.
Environmental factors. There's no definitive environmental factor, but anything that can cause an alteration in the WT1 and or WT2 gene, such as smoking or exposure to any carcinogen, should be avoided.
Prevention. There is no way to completely prevent this cancer. However, if a child has the signs and symptoms, you can get kidney ultrasounds to detect this cancer at an early stage.